expectancy for sickle cell patients in the United Kingdom and other developed countries is put at 50 to 55 years, while in developing countries like Nigeria, it is much lower. The reason for this wide gap, according to Dr. Bolale Idowu, general practitioner in the United Kingdom, is due to poor level of care, which can be improved upon through more private sector involvement. She gave the advice during a visit to the Lagos University Teaching Hospital at Idiaraba, Lagos.
After sickle cell patient is a multidisciplinary thing. In the UK, for example, where I practice, they would have their own doctors, their own specialist nurse, their own psychologist, their own occupational therapist. All of those things come together as a package. And that is what we should be aiming for in Nigeria.
Dr. Bolale Idowu was also the coordinator of Azizat Olajumoke Foundation. Did not just make her input to improve sickle cell patients' care in Nigeria, but matched her words with action by donating some state-of-the-art monitors to the management of LUTH.
This is presented to LUTH on behalf of the Azizat Olajumoke Foundation.
Kind of gesture is actually really what we need if we really hope to improve on what we have already. You are aware that Nigeria being a developing country, like any other developing country, we are resource challenged.
A lot of the time we tend to use manpower to monitor these things, but when you can use multiparameter methods to monitor them, especially during labor, during late pregnancy, when they're admitted, during delivery, it will definitely make a great deal of difference to their care.
The passion for a better life for sickle cell patients by Dr. Idowu and her entire family was birthed by the death of her sister, Olajumoke, who died of the disease at the age of 50.
Normally, the lifespan of a red cell should be about 120 days. But in sickle cells, because of the inherited abnormality which makes those cells to sickle, they don't last beyond 10 to 20 days. So because of this, the individual is usually short of blood, or what we call chronic hemolysis and anemia. And then also because those cells get disfigured, they become sickled and disfigured, they also tend to block blood vessels, causing what we call vaso-occlusion, which is the cause of the pain and the organ abnormalities or dysfunction that they suffer.
The sky is not the limit for them. They can go on. My sister was a chartered accountant, and she worked in several banks before she wasn't able to work anymore. So every sickler should have the opportunity to be able to attain the best of the maximum that they can.
Sickle cell disorder, also known as hemoglobin S disease, is the most common inherited blood disorder. Nearly 90% of the world's sickle cell population live in countries like Nigeria, Democratic Republic of Congo, and India.
People should know their genotype, okay, before they get married, and make this informed decision.
Babies born with sickle cell disorder usually show symptoms at about 5 months of age. These symptoms include anemia, pain crisis, swelling of hands and legs, frequent infections, and developmental delay. Oshuomowa Daniels, AIT News, Lagos.
The Catholic Archbishop of Lagos, Most Reverend Adewa